Hi, I'm live. Hi, everybody. Hi. Well, if you are connected, please wave, um, comment, let me know you are here. Make sure you type your questions. Of course, this is Rachel from the MPH Live, coming to you on this third day of October. Very thankful. Ian, they called it. I was calling it Ian. Go figure. But very thankful Ian did not get here as it was supposed to, and very heartbroken over what it all did southward. So if you have it in your heart, if you are able to consider donating to the local organizations that are helping there. Um, as of today, last time I checked, with top 100. And I mean, the hurricane has done a lot of damage other places too. And in Florida, I guess, in a sense, I don't want to say we are used to hurricanes, but we see hurricanes. This will be my fourth one in 6 years living here. And um, this is the first time, this is the first time we are getting damages of this nature down that way. One of the reasons why I'm glad I'm up this way. But that's that. So I want to thank each and every one of you that checked on me, that made sure I was okay. I'm very thankful for you all. I appreciate you. Um, but this is Rachel with the MTH Life, and today we are going to talk about breast cancer. October is Breast Cancer Awareness Month. Okay. And I will answer another question I was asked about care management before I jump in. I was asked, what is the benefit of having a care manager? One of the benefits lots of folks don't realize is family conflict resolution. That is when siblings are crashing over mom or dad's care or health status. A care manager is an impartial person that will do assessment, present things as they are, present what possibilities, solution, things are out there. And so everybody is better informed and can agree on decision. Not only that, we can facilitate family meeting when it comes to mom or dad's care, ensure everybody is heard and address the questions of each person. So that's one of the things a care manager does, especially senior care manager. Yes. All right. Um, we are going to jump into breast cancer today. Um, I think we all know, whether close or far, we know somebody that has dealt with this. There are all sorts of cancer out there, but October is about breast cancer, so we'll focus on that. And oftentimes there is that sense of, when it happens, you really don't have control over it. As in, I cannot really prevent breast cancer if it's meant to be. In a sense, that is true. In a sense, that is true. However, if you are carrying that mutation, that gene mutation, something has to turn it on. And so sometimes it is exposure, sometimes it is diet. There are several things that could play into turning that gene and getting it all active and starting its nasty job. In practice, though, what really I almost want to say traumatizes me or shocks me every single time is the amount of women that do not practice breast self exam. I personally teach my teenage patients, if you are the age of getting a PAP, which can be 18 depending on your activity, 21, I stand corrected, 21 depending on your activity, um, you should be doing breast self exam. But even before that stage, as you have grown, you should start doing breast self exam. Why is that? So you know your breast tissues. In normal breast tissues, you will feel some stuff in there, which is normal. That's the tissue, that's how it is That's how it is designed in a sense. And a way you can catch on early when something is off is when you are very familiar with how your breast tissue feels. You know, it doesn't have to get painful. It doesn't have to get the deep, the implant, the orange skin deep. It doesn't have to start producing some discharges. It doesn't have to start turning color before you realize, oh, something is wrong. Typically, when it is at that point, it's not freshly early on, you know. So the one thing I want to tell women about breast cancer is the importance, I cannot stress enough, the importance of practicing breast exam. Okay, if you tend to forget, one easy way to remember is each month at that time of the month. You know, every time that time of the month occurs, you should do your breast self exam, preferably in the same position, whether you are lying or standing in the shower. Um, and in front of a mirror is also a very good idea. Okay, so that's one thing I wanted to tell you ladies about breast cancer. I think everybody's familiar with symptoms of breast abnormality. I say breast abnormality because not everything that comes is cancer. Obviously, sometimes you may have a cyst, sometimes it's an infection, sometimes it's just hormonal. So you don't n- not everything is breast cancer, okay? But believe it or not, almost 50% of the diagnosed breast cancer cases do not have it in their family. That's a lot of people. If you have had breast cancer in your family, especially first degree relative, it's very easy to be more aware and wanting to be proactive. But those that don't have history in their families tend to think I'm safe. And interesting fact, this applies to men also. If there is breast cancer history in the family, in your family, you should kind of pay attention to it. If you have other risk factors that I will list later, I will list in a little bit here. Okay, so that's that. The other thing I want to mention is that normally, especially if there's any family history, mammography starts at 40 years old, ladies. It starts at 40. You should be, you should be going through a mammogram in your 40s. Typically, when you turn 40, that's when all the good things start, all the a whole lot of the prevention. Now, again, heavy history. If they found the gene mutation, you might start way earlier. The BRCA2, you might start earlier than that, depending on all the other criterias and how you meet them. So, but for a regular person, most people, it starts at 40. And so, if you happen to be somebody in your 40s and you don't have insurance, you cannot do this right now. The National Breast Cancer Foundation has a list of where you can get a mammogram for free in your area. You go on the website and you look for it. Same thing for freemammogram.org. That's it. Freemammogram.org. You can pull up the location where you can get free mammogram close to you. So there is still access, there is still a way, especially if you find something abnormal. If you find something abnormal. Okay? So I really want to encourage you all to be proactive when it comes to that. Don't think because you have small breast, you will never get cancer. Um, I hope it's more of a faith thing than because you have small breast. Because any breast gets cancer. Yes, heavier breasts tend to, but any breast can get cancer. And obesity, smoking, that type of thing doesn't help at all. Why obesity? Because when you are obese, you typically have higher level of estrogen, which tends to influence that cascade. So that's that. Now, I want to talk to the guys. Yes. Why? Because breast cancer is, I don't want to say it's becoming common, no, but it's occurring in men. If you were to think, if you were to see today or this time, comparing to 10 years ago, 20 years ago, 30 years ago, we are having more occurrence of breast cancer in men. Yes. This year alone, over 500 men will die of breast cancer. Over 2,500 men were diagnosed with breast cancer in 2018. That's the most recent data I have. Yeah. So 2,500, but these are men. Do you understand? So as rare as it is, it happens. It happens. And why should you be proactive? You should be proactive when you have certain risk factor. I mentioned obesity, smoking, things like that. You should be proactive, and that means doing breast exam. I recommend to some men that have the higher risk factor to do breast exam, just as much as I recommend to boys or teenage, older teenage and on to do, to keep an eye on the testicle and things like that. Be familiar with your body. So when something comes off, it's not way advanced and out there before you realize, oh, something is wrong. Right. So men, and if you are not going to do breast exam, you need to pay attention. And this concerns everybody. Ignoring symptoms don't make it go away. If you make changes because you think, oh, I pull a muscle or this or that, and it's still staying around, you should get checked. Ignoring symptoms, and I'm talking about men and women, does not make it go away. So for guys, I talked about the obesity again because you are producing more estrogen, um, breast cancer history in the family, heavy breast cancer history in the family. If you have liver disease, you are at risk. I'm not saying everybody that has liver disease is at risk or any of the other criteria I'm listing. I'm just telling you, okay, the risk factors for men. If you have liver disease, it kind of increases a little bit. If you have had testicle surgery, and let's say you have testicle surgery, you are obese, you smoke, all of those things. Do you see what I'm saying? You are adding on the risk factors, not on purpose, but as far as testicle surgery is not something somebody wants to do, just get up and wants to do. So testicle surgery will put you a little bit, will give you a little bit more risk. Or testicle disease. Okay, those that have chronic testicle inflammation, yeah, you want to watch that. And then there's a very important factor to age. Typically, breast cancer is diagnosed in men 60 and older. So, you know, that's one of the things to watch for. And then the other symptoms is I can never say this word, so I'm gonna have to read it. It's the Klinefelters. I say Klinefelters. Somebody must say Klinefelters. I say the things I want the way I want to say it. The Klinefelters syndrome. That is the boys born with an extra X chromosome. Yeah. And so typically development wise they don't have all the male features. They don't, they have lower male hormones, more of the female hormones, although they are boys. Those are people that, they don't all get breast cancer, but that's a risk factor. I hope that makes sense. So, overall, what I want to say is, be proactive, be aware, and know your body. Know your body, listen to your body. When it's giving you signs and symptoms, don't ignore it. If you make changes, you adjust, and it is still persisting, go get checked, okay? A woman that's not pregnant or anything should not be having breast discharge, or a man for that matter should not be having breast discharge. If you're having breast discharge, go get checked. I hope that's making sense. And my special thought tonight to those that have lost a loved one due to breast cancer. It is way more common, more more common than not. It's a loss. It is special thought for you all, and I'm gonna wish everybody a fantastic rest of the day. Stay out of trouble. Take good care of yourself. Reach out if you have questions, post, comments. Now, if you are watching this on YouTube, please don't forget to like, subscribe, and share with others. That would be very, very kind of you, and I really, really, really appreciate it. Okay. All right, guys. You have a good evening, and I will see you next time. Bye bye.